Hi all, today the topic is regarding the books that have to be covered during the DM nephrology residency or DNB nephrology residency and what book that we have covered during our residency. So this topic might be more for a first year resident or like beginning of the second year residents and what books to study. This is a kind of ritual question. Not only this year, every first year resident of nephrology will have this question, what book I am going to complete. But as you join the nephrology postings, then you will come to know you will hardly have time to complete it. But despite that, you should be aware what are the things that you have to complete. And when I started my journey, I was told to complete Brenner. But as soon as I saw Brenner, it was so big. I thought, how we are going to complete this? And this is so vast also. And a few people told somehow you have to buy Oxford textbook of nephrology, Figali, varied opinion. So I will take you through which books you have to cover or which might be helpful. So first, if you take the nephrology, it have to be divided into your particular sub branches. Like you have to complete core nephrology. You have to learn about transplant regarding hemodialysis, peritoneal dialysis, and finally for the exams, for your final exams. So this part we'll say separately. Initial 4 part from which book to complete. This one, Fiali. This book compulsorily either a DM or DNB nephrology resident should have it in hard copy because without this book you can't complete nephrology. And it is having only one volume. The contents are comprehensive and crisp. No in-depth details like Brenner. It won't make you hate the subject. It is tolerable and anyhow you have to start from beginning to the end. Anyhow, before you appear for your final exam, anyhow you people will complete this. And whichever seminar you are going to present, probably you have to take the contents from this one. And even any of your professors or assistant professor or your senior says the contents you have to take from more standard textbook. Anyhow, for the final exam, only this much knowledge to handle the core nephrology might be enough to pass the exam. And this gives a clarity of the subject also regarding the core nephrology topics. During our residency, did we complete the entire book? In the first year, no. In the second year, no. But in the third year, yes, before the exams, we have to go through all the topics starting from the basics till the transplant, and very, very important. So, compulsorily buy this book. Second, Brenner. Many of you might have heard your seniors or someone might have told this is Bible of nephrology, somehow you have to buy this. We have bought but we didn't study because the contents are given in a very much in-depth and mostly they compare it with the rats, they compare it with the rabbits, they will compare it with the previous studies, in-depth analysis. The resident during the residency with very much limited time, he will get irritated to read this book. You will have hardly 3 hours, 4 hours, probably at a particular day to study, probably on the weekend. And if you open any chapter, minimum 10 to 20 pages will be there. And they won't come to the conclusion directly. They will roam around, starting with how the appearance will be in rabbit, how its appearance will be in mouse, something like that. Then some theory part. Yes, it is a standard book, but it is a reference book. Is it compulsory to buy? Without buying this, you can smoothly pass your DM exam. Don't worry. Why it is important? Probably some of the tables in the Brenner might be very helpful for your exam, final exam. So in the beginning of your residency, probably this might not be a helpful book. And as you go up the ladder, second year and towards third year, probably tables might be helpful. A soft copy might be enough to get the contents there. And during our residency, we bought, but we didn't study even. Rather than saying complete, just we went through at least I went through the tables. For in the glomerulonephritis, under the core nephrology heading, to complete the glomerulonephritis, you have to go through the KDIGO guidelines, the latest one. Go to the KDIGO website, download the glomerulonephritis guideline and take a printout. Probably only the recommendation and summary, which is given in bold letters, might be helpful to know the latest guidelines and what are the treatment option available. This is very much required, and as your ward posting start, you have to watch these guideline one pages. Probably in 5-10 minutes you can go through that, how much steroids to be given, how long to be given, those and all. These guidelines will be very helpful, and it will be helpful in your ward treatment management also. Oxford Textbook of Clinical Nephrology, I think 2 or 3 volumes are there. Probably renal tubular acidosis chapter is very well given. This is also a reference book, probably no need to buy. In the first year, second year, probably of very much help. If you want to understand a particular topic in depth, you can use it as a reference book. Probably you will get from the college library. Again, no need to buy. Even though we got the suggestions to study renal tubular acidosis from this one, I didn't studied any topic or for anything. I didn't refer this book. So during our residency, we didn't use. Next, the most important one is from up to date. Either if your college is having access to up to date, well and good. If not, 3 or 4 of your friends can combine together and get the subscription. With up to date, you will get the clarity about the subject or a particular topic. For example, CKD mineral bone disease or newer treatment of anemia and CKD. This kind of important topics are a particular type of question or better answer with latest update in up to date. And the information is very well orientedly given in this. No need to go for the latest update to the latest article again to study from the textbook. These kind of haphazardness won't be there. You'll get a clear understanding regarding a particular topic with up to date. So as you start seeing the ward patients, whichever the cases, you can go through up to date. Probably a summary and recommendation only if you doesn't have time. If you have time, go through the entire topic. 2 important journals, AGKD, American Journal of Kidney Disease, and CJASN. They release summary of a particular topic very nicely. AGKD by the name core curriculum. For a particular topic, the entire topic will be very well covered. For example, SLE under core curriculum is very well covered. Membranous nephropathy, latest treatment of anti-PLA2R. What are the practical difficulties? As a nephrology resident, the major doubt you might be having is, for example, in the textbook, membranous nephropathy, they will say, give treatment for 6 months, probably the response will come. But in the practical, you will be seeing patient who might not have responded till 6th month, again relapse. Then patient might be non-compliant to treatment. He might not be affording to rituximab. You might have seen a patient who is responding to rituximab. Lot of doubts will be there with respect to glomerulonephritis. Those kind of practical related question, and when to do the steroid dose reduction are better given in AGKD core curriculum. And whenever you see a good topic under AGKD core curriculum, just download it, take a printout. So take a printout of a particular 10 to 20 topic and make it a spiral binding, because once you study online, after 3 months you might not be knowing from where you studied. And this problem frequently occurred with me also. I might have studied some topic 3-4 months back with well orientedly given topic. After 3-4 months I might not be knowing from where I have studied, because the PDF file you might have downloaded, it might not be in the particular folder. Otherwise, you have to be very well organized in your desktop or laptop so that you can go and review the article. And if your college is having a DM program for the last few years, you have to collect the PPT, because during DM residency you will have a lot of presentations like journal clubs, seminars. You have to start collecting the PPT because the PowerPoint presentation by the seniors or your colleagues will have a lot of condensed information, so no need to haphazardly roam around to find the information. For example, post-transplant infections, immunological workup, bioimpedance, these kind of PPT. Bioimpedance you might not get in any textbook. You have to go through the articles. If you go to articles, the information might be patchy. So the student or your senior might have went through the topic in depth before the seminar. He might have made the PPT. So you have to start collecting the PPT. If you are having seniors, well and good. If not there, so however possible, I am uploading the difficult topics that I felt during my residency that I am uploading. So this is also one way you have to start doing from first year so that it will be helpful in your third year. Second, regarding the dialysis, compulsorily you have to buy this book, Handbook of Dialysis. Very difficult to complete the entire book, but at least for the sake of completing dialysis, right from the first year, start carrying this book or keep this book in your room whenever you have time. Go through this, starting from EGFR calculation, starting from assessment of kidney function, creatinine clearance, everything is given here. The only thing is, it will be very boring to read this book. And the dialysis concept, especially KT by V, it is very confusingly given. At least few of your friends should join together to understand this, or probably from some online source you have to study regarding KT by V and all. Otherwise, probably in upcoming videos I will try to clear the concepts of dialysis. Anyhow, during your third year, for the dialysis understanding, you have to go through the important topics of this book. So this is a important book which you have to buy as a hard copy and keep it with you. Even peritoneal dialysis is also given in this. Peritoneal anatomy, peritoneal membrane anatomy, the 3-pore model is better given here. You have to go through this book. Did we complete it during our residency? No, I could not complete. I just went through the important topics. And regarding KT by V, I didn't study from this book because I could not understand the concepts well. I studied from some online article. And overall, we went through the pages to look for any particular tabular column to answer the Viva question and all. Especially in the third year, in the first and second year, we could not complete. At least I could not complete. This book might be helpful during your transplant posting. Probably a hard copy. The place where I did DM residency, we had transplant posting for 4 months, especially in the second year to third year switchover period. During this time, this book is very important to understand the concept of fluid management in the post-transplant period. What are all the immediate post-transplant complication? How to manage the graft? What are all the storage fluid after receiving the kidney from the donor? These kind of practical questions might be asked. And the transplant immunosuppressions, I studied from online journals only. And in the particular institute, you have to be very clear what is the guideline being followed. And at least out of 3 years, once or twice, you visit the OT and see what is the process starting from taking the kidney out from the donor till it placed in the recipient. The examiner might ask where they are storing the kidney, what is the fluid they are using to flush the kidney, whether it is manual or automated. These are common questions. If you didn't attend the operation theater as a nephrology resident for observation, you might get some question. In the first year, not required. Probably during your transplant posting, it might be required. Is it compulsory to complete the entire book? No, only the important chapter, like probably the post-renal transplant, fluid management, immediate complications, the donor kidney retrieval, these kind of topics. And regarding the renal pathology, this is the standard textbook, Heppenstall pathology of the kidney. No need to buy the hard copy. Even the soft copy will be enough. And all the pathology related things, probably glomerulonephritis, you might encounter a lot of histopathology related questions. To solve those concepts, probably this book might be helpful. Did I study this book during my DM residency? No, I not even touched this book because I didn't have time to read this. And in this book, the information is probably given in depth. For histopathology, I studied some online article where all the concepts has been very clear, and a few of my pathology friends were there. They have cleared the concept of kidney biopsy, because during your entire 3 years you have to be very clear with kidney biopsy, how to interpret by seeing by yourself without the pathologist help. To that level you have to be well versed with the histopathology. Even the post transplant biopsy interpretation is very important. How to say percentage of fibrosis, how to say IVT, there are a lot of nomenclature that you have to be aware of. For that Banff criteria, the entire article is very important. But if someone asks, this was the suggestion I got in my first year residency, and a few of my seniors have studied also, they told this book is very good. A soft copy will be more than enough. So at this point of time, a first year resident who is entering the DM should be aware the difference between MD medicine or MD pedia and coming to DM nephro or DNB nephro. In MD medicine, probably the information mostly condensed with Harrison. For practical, if we go Kundu, Alagappa, these kind of books where the most information is condensed. You might not have told to go through lot of articles for journal club, latest update, that and all, probably you might not have encountered in MD. Whereas in DM, the contents are distributed. For example, for latest content, you have to go through the latest guidelines. You have to, many a times your presentation might be related to journal club. You have to keep on updating the things. And many a times topic might not be in a particular book. For example, bioimpedance, post-transplant biopsy interpretation, even the ANCA-associated vasculitis trials, lot of time landmark trials. In MD, we hardly have gone through these kind of landmark trial in diabetes, something like that. Whereas in DM, you have to be very much updated regarding the landmark trials, which was the trial done first, why the treatment was changed, till the end you have to be aware of. And with respect to DM residency, you should know the excuse me, in DM nephrology residency you should know how the treatment started, why it changed, and what is the percentage of response to a particular treatment. In MD only, probably the treatment care, you should know what is the percentage of response, what is the percentage of complication, what is the latest trial, how much they have told. These kind of questions might be there during your residency, but once you complete DM, probably in the clinical practice that much importance might not be there. But during your DM residency, these are all the things you might encounter in your ward rounds also. And start collecting the article, whichever article you feel good, start collecting it in a particular folder or make a series of folder so that you won't miss those articles. For example, there was a very good article regarding SGLT2 inhibitor, I think, which was published in AGKD. So those kind of article you have to download and keep it with you, because nowhere you will get a condensed information of SGLT2 inhibitors. And the KDIGO guidelines, vascular access guideline, there are guidelines for interventions also that I didn't cover in those, because in the first year you might not be given much of intervention till the time you complete at least 6 months. And with respect to junior's question, is there any particular book for clinical examination in nephrology. No, there is no specific book. Either you have to follow what you followed for your MD only, like Kundu, Alagappa, or McLeod, whatever it is. And another important point is collect articles. So in summary, anyhow you have to complete fairly. There is no doubt about it. Before your third year or before you appear for exam, anyhow, from page starting to end, you have to go study these. For ward cases, use up to date. Up to date gives a clear, oriented, condensed information. For hemodialysis, use that Dougrias book whenever you get time, or at least for the namesake, since you are DM residency first year, carry that book. Third one is try to collect articles from AGKD. That is also a very well oriented, condensed information journal. And for exam question, probably you might start reading in your third year. So since this video is for first year resident, for exam questions I didn't cover here. And transplant, probably you have to buy that Danovich book during your transplant posting. So as of now, at least buy Fihali, Daugridas and the transplant handbook. Rest up-to-date subscription and a few important journal articles. That's all. Bye bye.